The Cumming Global Centre for Pandemic Therapeutics would like to acknowledge the traditional custodians of the land on which we've recorded this podcast series, the Wurundjeri people of the Kulin Nations, and we pay our respects to all elders past, present and emerging. Off Script is brought to you by the Cumming Global Centre for Pandemic Therapeutics, part of the Peter Doherty Institute for Infection and Immunity. I'm Dr. Matt Agnew, your host. We've reached the final episode of this 5-part series, and today we're imagining the pandemic future we could have if we start preparing now. As you've heard throughout this series, therapeutic drugs are an essential part of a comprehensive pandemic response. If therapeutics are ready to go before the next pandemic arrives, we can keep more people out of hospital and we can help keep the economy running. One person who understands the economic impact of pandemics better than most is health economist Dr. Angela Jackson. Angela co-led the independent inquiry into Australia's response to the COVID-19 pandemic along with Robin Crook and Professor Catherine Bennett. The inquiry received over 2,000 public submissions and hosted 27 roundtables, culminating in a 700-plus page report. Suffice to say, Ange has thought a lot about pandemic responses. These days, she heads up social policy at Australia's Productivity Commission, and today, she's right here with us in Melbourne. I'm joined now by Angela Jackson. Thank you for joining us, Angela.
Thanks for having us.
The independent review you co-led into Australia's COVID-19 response was handed down last October. One of your key findings was that we can't afford to ignore the economic impact of a pandemic. We need to plan for it up front. As a health economist, you're uniquely placed to make that claim. Do you want to kind of expand on what that looks like within the reporting context and what the impacts look like going forwards?
Yeah, look, it's interesting thinking back, obviously, to the start of the pandemic, and we sort of tried to do that. It's a bit of 2020 hindsight, but we went back and looked at the pre-pandemic plans going in, and there was really no mention of the economic impacts, let alone any planning for what type of economic supports might be needed and how a pandemic might play out. Now, it's interesting because then you, in hindsight, obviously, you can see that actually, as much as it was a health crisis, and we still talk about that a lot, and it was also impacted us socially, it was also the biggest economic shock of our lifetimes. We saw economic growth go backwards about 7% in one quarter, which is just a huge decline. 800,000 people lost their jobs over a 2-month period. This type of economic shocks that were sort of unleashed on our economy weren't planned for. We didn't really have responses ready. And what that meant was that, the nature of those responses had to be sort of done on the fly, and so what we're really recommending is that for the next pandemic, we really think about pandemics in terms of being, yes, a health shock, yes, a social shock, but also an economic shock, and we get ready and we plan for that in advance. It
definitely felt a lot of it was just kind of done live, and it sounds like Was there any sort of consideration in terms of that economic shock prior, or it really was something that was a bit of a blind spot for us?
It was a blind spot, and I think particularly initially when we were just coming to grips with what a global pandemic might mean. In fact, the response was very much what you would normally do in a recession. So we had sort of individual payments to people, those sort of demand side measures. There was no real comprehension of, wait a minute, if we stop the economy, if we keep everyone at home, what is that going to mean? And so things like JobKeeper, no one had come up with that idea before. We came up with it on the fly. Thankfully, we had the systems that the ATO had literally put into place, single touch payroll 6 months before. Nothing to do with the pandemic, just happenstance, which meant we could have a policy like JobKeeper, which was fundamentally important both to the economic response, but as we also highlight, to the health response. So by being able to support people to stay at home and limit their activity, that also made the health response more successful, particularly in that first wave of the pandemic.
The independent review found delays in vaccine procurement and distribution prolonged public health measures like lockdowns. But where do you see pandemic therapeutics fitting into a comprehensive pandemic response?
Look, I think the treatment side of things is obviously important. And again, you've got to think to, decision makers. If you're the Prime Minister or the Premier of the state and a new pathogen comes along and you have no way to treat people who have it, well, you're going to be a lot more risk averse to that than you are, oh, yep, we've got this new pathogen, but look, we've got a treatment. And so when people get it, we can provide this and the recovery rates this. And suddenly everything is a lot more, the risks, the trade-offs for those decision makers, they're in a much stronger position to be able to make those trade-offs and understand, what their choices are. If you're presented with we have this new virus, it kills 2 to 3%, we've got, and makes everyone, another 10% very sick, so they have to be hospitalised for 3 weeks. That means your hospital system's going to be at capacity within 3 weeks,
Things collapse quickly.
Things collapse quickly, and as a leader, then you have to act in a more extreme way than perhaps if you had, access to treatments.
Yep.
Vaccines are obviously, that's
instrumental
and very important. But, treatments that can keep people healthy and keep people out of hospital are also vitally important.
Is that something this is probably a bit of a how long's a piece of string type question, but is it something you can kind of quantify in some way when you're doing that report in terms of if you had over-the-counter GP, easily accessible therapeutics, the significant kind of reduction in economic shock?
It's difficult because it depends on the parameters. We know that the national lockdowns cost around $3 billion a week,
okay.
Rule of thumb. So
Yep.
it's, again, not spare change.
No.
So, the extent to which you can avoid that versus, less restrictive, because you might still need some restrictions on activity, right, in a pandemic scenario, even if you had therapeutics or you had treatments available.
Yep.
That's more around the 600 million mark. Now, again, it's not spare change, but the difference is significant. And the impact on people's lives is obviously also significant. If you can keep schools open, for example, that makes a massive difference. So, I think it's difficult to quantify because you need the scenario, what's pathogen, what's the treatment effect, all those things.
Yep.
But certainly the potential wins are significant.
So therapeutics, obviously something we didn't have widely available during the COVID-19 pandemic. If we were to have them available for the next pandemic, how do you see that benefiting, and where do you see it, I guess, creating more relief?
So, if you think about it, and one of the issues with COVID obviously was it'll say a 3-week on average hospitalisation, which is long, right? It's a lot of time in hospital. So if a therapeutic can avoid that hospitalisation or, avoid 20% of those hospitalisations or reduce the length of stay, by a week, then suddenly your hospital capacity becomes a lot bigger. And so the amount of, transmission that you can sort of accept, I guess, or that's a level that the system can withstand suddenly goes up. And that means less restrictive other practices are needed. It's a very careful balancing act. And I think it's difficult sometimes for the community to, even in hindsight, understand what that balancing act looks like. It wasn't necessarily around saying no one should ever get COVID, was, because we obviously eventually opened up and we opened up to COVID, and sometimes it was sold as that, but really it was around, well, how can we live with this virus? And with no therapeutics and with a virus that makes people sick and can cause death, well, it's very hard to live with that virus in your community. So therapeutics obviously have a role to play, as they did during COVID. I think even the second and subsequent waves, more treatments were available. We understood what worked and what didn't, at least at some level. They weren't necessarily perhaps what they are today, but there was something there, versus when a virus first comes, to the fore, you've got no idea.
You're playing blind.
That's right. You're playing blind. And it's, there's obviously that creates a lot of fear as well. I remember at the time having, medical professionals who were friends, anaesthetists, and, there were a lot of people in that scenario who had to incubate people with COVID who were at high risk in terms of it. In terms of contracting the illness. And that's pretty scary when, you're at high risk of catching a deadly virus that has no known treatments and that's
terrifying.
Yeah. And so that's the zero tolerance approach. But therapeutics really do allow you to think a bit more around, well, how can we manage this virus and take a more risk-based approach? And that is something that, in terms of being critical about Australia's response, is we didn't pivot from that sort of very precautionary zero tolerance approach to that more risk-based approach over time.
Yes.
Which certainly, in the second year of the pandemic, as vaccines became available, but as therapies became available, we could have been a little bit more risk-based in our approach. And some of the sort of we can't accept any COVID wasn't necessarily helpful in terms of, I guess, the public's understanding of the virus and then their trust in government going forward.
Yeah, so you mentioned therapeutics obviously can relieve some of that strain on the health system. Similarly, can therapeutics help to prevent things like lockdowns?
So I think, like we were talking about, I think in terms of the toolbox, certainly it provides another tool that you can use, in that risk-based approach. It changes the risks trade-offs. So definitely, I think having therapeutics available and available earlier in a pandemic means that you can shift and pivot away from what we'd say is that precautionary approach where, and lockdowns aren't necessarily part of that either, but, in the case of COVID-19, it was certainly probably necessary. They're certainly in that first wave. So therapeutics, certainly, they add another, I guess, tool to the toolbox for people to use that can be an alternative to lockdowns, or at least change the nature of those movement restrictions.
Thank you for joining me, Angela. This has been a fantastic chat. Do you have any final thoughts that you'd like to share in terms of pandemic preparedness, economic preparedness for pandemics and crises, or therapeutics?
I just think overall, the more prepared we are, the more that those trade-offs can be made. I think there was that sense throughout the pandemic that we were over-prioritising health. Now, I don't necessarily sign up to that, but I think the more prepared you are, the more you are able to then trade off, well, what are the social costs, what are the economic costs, what are the health costs. When you go in completely unprepared and your system's not prepared, well then health will be the number one priority, and that will mean bigger economic and social costs than otherwise necessary.
Fantastic. Thank you so much for joining me, Angela.
Thank you. Thanks.
We've just heard from one of the country's leading health economists that pandemic therapeutics could ease the economic hit of the next pandemic. But what does our Chief Medical Officer, Michael Kidd, have to say about it? You might have seen Michael in the news in recent months, commenting on the worrying HKU5 virus. It's a virus originating in bats, and it's already mutated to one other species. Scientists say it could be just one mutation away from infecting humans, and our Chief Medical Officer is keeping a watchful eye. He's well versed in thinking about the future of health systems. He was previously Professor of Global Primary Care and Future Health Systems at the University of Oxford and Director of the International Centre for Future Health Systems at the University of New South Wales. Michael Kidd, Chief Medical Officer, first things first, congratulations on the recent appointment.
Thank you, Matt. It's a great privilege to be in this role as Australia's CMO.
No, thank you. And we're really grateful for your time today, obviously, to chat with us. Throughout this series, one of the key things we've heard about is the major investment in pandemic therapeutics happening right here at the Cumming Global Centre. As someone who thinks deeply about the future of our health system, what role do you see therapeutics playing when the next pandemic hits?
Yeah, well, Matt, I think you're right when you say when the next pandemic hits rather than if the next pandemic hits, because we know that there will be future pandemics. We just don't know when. And so it's essential that we have organisations like the Cumming Global Centre who are helping us to prepare for the future. So, and to answer your question, I believe that therapeutics are going to play a really important role in Australia's response to the next pandemic and the pandemic after that and the pandemic after that. We will need therapeutics just as we will need vaccines and we will need diagnostics to help us to control the impacts of any future pandemic. I think it's also important to recognise that it's not just therapeutics. We need the trust and we need the social licence for these sort of interventions, as well as for social and behavioural public health interventions that help us to manage future pandemics. And we need a strong focus on equity to ensure that everybody in our community benefits from the interventions, including therapeutics, and that some people are not disproportionately disadvantaged, which of course we saw happen with some groups during the COVID-19 pandemic. I think the other thing is, depending on the pathogen that causes the future pandemics, whether it's an influenza virus or another coronavirus or some other sort of virus, therapeutics are really going to help us to reduce the progression of infection to disease, helping us to, in COVID-19 speak, flatten the curve to help prevent our health services from being overwhelmed. They hopefully will be able to help to reduce disease severity And they'll also hopefully be able to help reduce the transmission of infections. And this, as we know, could be especially important if there is a gap between a pandemic beginning and effective vaccines becoming available, or if it takes time to get vaccines out to affected populations during a pandemic. So therapeutics, I think, are going to play a continuing really important role. They can, of course, also be tailored to meet the needs of different population groups and to address needs at different stages of a pandemic. So there are a whole lot of really exciting areas that I know the Centre is addressing, and really keen to work with you all on that in the future.
Yeah, so obviously a really comprehensive and multifaceted approach to tackling pandemic and having appropriate pandemic response. You've long been interested in how we translate scientific research into policy and practice. With the Australian Centre for Disease Control soon to come online, what do you think it will take to rapidly move research, including therapeutics, into public health interventions during the next pandemic?
Yeah, so the ability to rapidly move research into interventions, it depends on research which is already underway before a pandemic begins. It depends on having infrastructure in place. It depends on having researchers who are trained and who are leading teams which are well prepared. And this is why the research underway at the Doherty Institute and the Cumming Global Centre for Pandemic Therapeutics is so essential to Australia's preparedness. Moving research into interventions also requires the ability to rapidly coordinate at a national level expertise and evidence, and having the platforms to be able to do that. The Australian Centre for Disease Control, the ACDC, will support this endeavour and ensure that we're able to respond even quicker and in a more coordinated way than we ever have in the past. It'll also be providing evidence-based public health advice to the Commonwealth and to states and territories and to the public. And the Department of Health and Disability and Ageing at the national level will still continue to lead our national responses to health emergencies, informed by the advice which is brought together by the CDC. So whether the next pandemic comes from a known or an unknown pathogen, we need to be thinking about therapeutic research and development. We need to be thinking about trials and the manufacture of therapeutics and vaccines and diagnostics. We've had very significant investment by the Australian government into strengthening Australia's onshore clinical trial capacity and reinforcing our research and development capability, specifically around COVID-19 research. COVID-19 required a very rapid and adaptable response from both the Australian government and from our research sector. We saw the Medical Research Future Fund develop a specific coronavirus research response, and that was part of our national COVID-19 response plan. We've also seen the priority areas for investment being identified, which are around COVID-19 vaccine development, COVID-19 antiviral development, and respiratory medicine research on COVID-19. And throughout that COVID-19 research grant period, we saw over $183 million of research funding that was allocated. And additionally, as the pandemic evolved, we saw the global community recognize that there were key pieces of information which were needed to help to control what was a new virus and a new illness. And international collaborations are going to continue to be absolutely essential. And we're very fortunate in Australia that through organisations like the Doherty and the new Cumming Centre, we have very long-standing global research partnerships. Australia contributes to many of these, and we have our world-class researchers working with colleagues and global partners, coordinating research efforts, making sure that we're not unnecessarily duplicating efforts, making sure we're maximising the use of resources, partnering in clinical trials, encouraging our researchers and our pharmaceutical companies and our public health agencies and our regulatory authorities to all come together and to work together to accelerate the development of really important therapeutics and vaccines to help us in the future.
Speaking of future pandemics, are we essentially always on the brink of one? There's reports, obviously, with the HKU5 virus jumping between species. Are we doing enough to prepare and like you said earlier in our interview, it's not a case of if, it's a case of when.
Yes, so the answer is yes. And I think it's important to acknowledge up front that Australia was one of the most successful countries in our response to the COVID-19 pandemic and our ability to protect the population of our nation. But that's not to say that we handled everything perfectly, and it's important to consider what we've learned. And again, the findings and recommendations of the National COVID-19 Inquiry are helping to shape preparations for the future. The establishment of the Centre for Disease Control is a really important part of that, but the Australian Government Department of Health, Disability and Ageing has also expanded its health emergency response exercising program. Over the last 12 months, we've had 2 major multi-jurisdictional emergency exercises involving the Australian Health Protection Committee and the National Health Emergency Management Subcommittee to look at how well we would respond to future emergencies and how well prepared we are. When it comes to preparing for influenza pandemics, the Australian Department of Health and Disability and Ageing has taken a very proactive, science-driven approach, and central to this is the Australian Health Management Plan for Pandemic Influenza, and it outlines the national framework for minimising the health impact of future influenza pandemics. We maintain the National Medical Stockpile, which includes volumes of pre-pandemic influenza vaccines, antiviral medications and other therapeutics to allow us to ensure that we have the capacity for rapid deployment and response when and where an outbreak might occur. And another recent measure was the establishment of the Commonwealth Procurement Panel to source high-quality personal protective equipment, rapid antigen tests for the next 5 years. And that move helps to reinforce our frontline defences and represents a critical preparedness mechanism. Also means that we're able to prepare and support our health workforce, who are often right at the vanguard of what's happening with the pandemic. There's been a lot of work which has been happening over the last few years, and the establishment of the CDC is part of that progression. I have no doubt that therapeutics are going to play a really essential role in future pandemics, especially in protecting our health system from being overwhelmed and enabling our society to continue to function during a time of national emergency. And I really commend the work which the centre is doing, and thank the great researchers that we have involved in that work.
And just to wrap things up, our chat's been obviously really comprehensive about the risks of the next pandemic and our preparedness and how things will differ in our pandemic management compared to what we've just been through. Touching back on the therapeutics part that we mentioned up front of this chat, what impact could widely available pandemic therapeutics have on our health system and our economy?
So therapeutics have the potential to help us to reduce the progression of infection to disease, and this can help to flatten the curve, as we talked about during COVID-19, to prevent our health systems from being overwhelmed by the impact of a new infection, and also the therapeutics have the potential to reduce disease severity and reduce transmission of infection from person to person. And this is incredibly important if we have a gap between when a vaccine is unavailable to becoming available, and also with the time that it takes to manufacture vaccines and then to distribute vaccines to the population right across the country. Or therapeutics also may be important if the vaccines which are developed are less than fully effective, so the therapeutics may actually add value in adding protections as well. And all of this, as well as helping to protect our population and protect our health system, also helps to protect our economy, because the more that we can keep the economy functioning, the more that we can make sure that essential services are continuing to roll out. And there was huge attention to this during the COVID-19 pandemic, making sure that essential industries were still able to run, making sure that the population were able to be supplied with food, we're able to access medical care, we're able to access medicines, we're able to access education, and much, much more. So these are all really important elements of keeping the country going. Again, Australia did well compared to many other countries during COVID-19, but there's still many lessons to learn and ways that we may look at doing things differently in the future.
Fantastic. Thank you so much, Michael, for your time today. This has been a wonderful chat.
Thank you, and thanks to you, and thanks to the work of everyone at the News Centre.
There's one face we Victorians saw on our screens almost every day during COVID-19, Professor Brett Sutton. Brett was Victoria's Chief Health Officer from 2019 to 2023, before shifting gears to join the Health and Biosecurity Research Unit at the CSIRO, our national science agency. He and I have something in common. We're both passionate advocates for trust in science. Alrighty. Brett, thank you so much for joining me.
Pleasure.
We'll jump straight in. How important is science and scientific research to our everyday life here in Australia?
It's absolutely fundamental. And I think it's one of those elements that are so fundamental that we don't see it. And yet if we were to interrogate all of those aspects of our lives and actually dig down, we'd find science behind almost everything. Science or engineering or technology of one kind or another. But science is that underpinning bit that's allowed engineering to flourish, that's allowed all our tech innovations to flourish as well. So it's super critical.
Absolutely. And globally, we've seen the rise of misinformation and a decline in trust in science. How can we protect and strengthen trust in science here in Australia? And what role do scientists themselves play as part of that?
I think it's a tricky game. It's a really significant challenge for everyone, and there's multiple forces at play. There's obviously AI in terms of what it can do for mis and disinformation generation and fake news, deep fakes, but also the way that social media can amplify misinformation, as well as the deliberately wrong information, disinformation. And so I think we need to get into those spaces as much as we can with trusted sources, but again, to the issue of opening up the bonnet to say that not all information is equal. You will be bombarded from all directions, and you need to have an appropriate level of critique of all of that. But here are the features of what might look like good information or more trusted information, and here are the features of things that can be completely out of whack. And it's also the case that in the world of science journalism and science publication, there's differing strengths of evidence for things. And the case history is the weakest. It's just a single paper, a single incident, versus those systematically put together science compendiums, if you like, on an issue. And so people do need to understand that, Facebook news feeds and various other chat groups are probably not going to be the most robust. Sure, you might get truthful information, but you'll be swamped, and you need to have some appropriate tools to navigate that.
We mentioned a little bit about multi-contributory community involvement of scientists, policymakers, society. What does meaningful collaboration between scientists, policymakers and communities look like when it comes to preventing the next pandemic?
I think it's everyone coming together for, as much integrated and robust conversation about how important it is that there's, if not complete alignment, just an eyes wide open, deep understanding of what the challenge is, what needs to fall into place for us to be as prepared as possible, and that no one sector, no one part of this equation can do it on its own. It's not enough for researchers to provide all of the analysis and innovations and technology if there isn't a policy environment that can support it appropriately so that people trust it and so that it can be effectively embedded in our healthcare and social systems. Policymakers can't just come in with regulatory and legislative elements without understanding what the emergent technology is, what the emergent hazards and risks and threats are globally. And we all need to understand that these are essentially low probability, high consequence / catastrophic consequence events. And so we can all fall into that rather unfortunate stupor of thinking, it's probably 20 years away and it could be 20 days away. I desperately hope it's 200 years away. We all do. But we can't go forward thinking it's business as usual and we don't need to do anything differently. We really need to lean in hard because the preparedness and planning will reap benefits far above a response that happens, even rapidly after something happens without the preparation. The preparation means so much.
Going to take a little pivot. In your new role at CSIRO, do you spend much time thinking about the next pandemic?
Possibly less than some people might think I would, and maybe more than I think I should. Look, a reasonable amount. It's clearly something we all need to continue to engage with. I don't think we need to obsess over it. I don't think we need to sit in anxiety about it, but we absolutely need to crack on with the things that are required to prepare ourselves, and that includes, getting the infrastructure and the policy settings and the social license in the best possible position to prepare ourselves.
Let's imagine the next pandemic has arrived, but this time around therapeutic drugs are widely available. People can go to their chemist, GP, and access medications which reduce their symptoms, maybe even keep them out of hospital. What kind of difference do you think that would make for a future pandemic?
Clearly a huge difference. I think all of those things need to be in place to make sure that it maximises the opportunity to make a difference, which means accessible, affordable, appropriate for individuals, and then that issue of social licence. And so you don't want people shying away from something that can save their life if they don't trust it. mRNA vaccines had a 20-year history before they were developed for SARS-CoV-2, but they were called experimental.
Yep.
They're as experimental as our seasonal flu vaccine, which is not experimental at all. It goes through a process every year, which is really robust and has the quality and safety oversight of all of our drugs. Same thing. But because it'll have a newness about it, because it's a therapeutic for a new threat, it also needs to be enabled by being trusted. Yep. I think it'll play out more effectively in some ways than vaccines, because vaccines need to be given to you or I as a healthy individual. Therapeutics are when we're unwell or when we're already in hospital or when we're sick at home and we know we need something. Yep. That possibly makes it easier. I still think we need the trust for something that might be developed in a really rapid period of time. But I do think if we can get those elements right, the actual therapeutic brilliance of whatever might be produced will speak for itself. And it doesn't matter what other things that we have in place. We can have the best healthcare in the world. People might be vaccinated. There are always individuals who are much, much more at risk of severe outcomes. And so, if you're on chemo, if you've got severe immunosuppression, those therapeutics are absolutely critical to save your life. So I hope they're in place.
Yeah. Fantastic, Brett. That's all the big questions we wanted to jump into. Is there anything you'd like to include as well?
I think a key thing for me is that pandemics have driven inequality and inequity. The most disadvantaged in society tend to get the roughest deal. Therapeutics are a way of evening that up, especially if they can be made widely available and accessible to people. And so I think, for people who are at higher risk, it's really something that we can and should be positive about and optimistic that it's one of those protective mechanisms for those who need it the most.
Fantastic. Brett, thank you so much for joining me. It's been a wonderful chat, and best of luck with the new position at CSIRO.
Thanks so much.
So pandemic therapeutics are a key piece of kit in our pandemic arsenal, with the potential to cushion the impact on our health system and our economy. And now's the time to invest, not when the next pandemic hits. We need to continue the groundbreaking research happening right here in the Cumming Global Centre for Pandemic Therapeutics. And who better to have the last word on that than Professor Sharon Lewin. So Sharon, the Cumming Global Centre for Pandemic Therapeutics has been going strong for nearly 3 years now. And in early 2026, we're set to see the official launch of the Australian Centre for Disease Control, a big step toward boosting Australia's preparedness for future public health emergencies will be involved in the establishment of that Australian Centre for Disease Control. So these things seem to be moving in the right direction. Are you feeling optimistic that we'll be ready for the next pandemic, not if, but when it comes?
Well, I'm ever the optimist, glass half full person, and I think we've definitely put many things in place that will put us in a better position. You named the Australian CDC, very important initiative for Australia, a central body that can coordinate largely data collection and policy advice for government. It's independent of government, really very, very important, and establish coordination around the country. We have learnt many things. We've got much better, I'm just talking about Australia right now, much better capabilities in mRNA manufacturing, which didn't exist in the last pandemic, with Moderna being based here, BioNTech being based here, and CSL manufacturing mRNA. And some investment, as we know, with new technologies that we're going to need for therapeutics through the Cumming Centre. The Australian Institute for Infectious Disease, another big investment from the Victorian government to give us better facilities to work with new pathogens of pandemic potential. But we still have a lot of different things that haven't yet been solved. These are very big global issues. So not everything is, I can't say that we're 100% better prepared. A few things that I think we really need to work on in peacetime is really trust in science and trust in leadership. That political leadership really is going to make the right recommendations in the event of a public health crisis.
What's the outlook for pandemic therapeutics look like, and how do you see, or how soon do you think this might be, or an antiviral might be available for a pandemic virus on the shelves at chemists and just having that super easy access in the future?
Yeah, that's the overall goal. Because if you really want to use therapeutics at scale, especially for people that may have contracted the virus but not yet sick, you need to be able to access those antiviral drugs in the community. So in short, we're way off that right now. And when we talk about pandemics, there's a whole range of different sorts of pathogens we worry about. So you can have a global pandemic like SARS-CoV-2, but we have outbreaks of pathogens of pandemic potential really all the time. So in the last years, we've been worried about monkeypox, for example, or mpox. We've had outbreaks of something called Japanese encephalitis in Australia, never before. An old virus, but we're seeing it now in Australia. We've had outbreaks of Murray Valley encephalitis. We've got outbreaks of new coronaviruses. So these are happening all the time. And so people are working on therapeutics for them. Remember, once you actually get a drug that looks good, you have to go through a whole lot of steps to evaluate if it's safe, first of all, phase 1. If it does what you think it's going to do in phase 2, and then in phase 3, demonstrate at scale that it actually works and has an effect. I think there's a lot more people thinking about this issue. There's certainly more funding going towards that issue. It is still not an attractive area for companies to spend a lot of funding because they would be needing to invest in something that they're never sure is really going to happen. So that's why governments have to play a very important role here in the investment. I think the experience of COVID-19 has taught the world, and there's many groups around the world discussing why therapeutics needs to be on the agenda, just like we need very good diagnostics and even better vaccines. So the investment is there. Have we got a whole lot more products right now? I couldn't say we do, but I'm sure we will see more. And certainly people are trying to fill their stocks or the cupboards that we can reach into the antivirals that could potentially work for the future. There's many groups around the world working on that as well.
What's your message to listeners, to government, to scientists, to households across the country in regards to pandemic preparedness and therapeutics?
Well, my message is that pandemics will not go away. We're going to see more infectious disease outbreaks as time goes on for a whole range of reasons. And no one can really predict if and when we will see a pandemic of the scale of SARS-CoV-2, and hopefully we won't. And I do believe that science has the tools to respond to these great challenges, and that's through better diagnostics, better therapeutics, better vaccines, and better ways we can collect data. But we need to take the community along with us in that journey. And these things don't come cheaply. Real big breakthroughs in the science come with needing significant investment. but the benefit of it is just enormous. The contribution that science can make to these great challenges cannot be underestimated. And imagine where we would be right now if we had never developed a vaccine for COVID-19. Think back to the images on our TVs of northern Italy in April 2020, of New York, of the large numbers of deaths in the elderly, but also in young people. And that would have been continuing for months, if not years, as we saw with the massive 1918 flu outbreaks pandemic. So I think science needs investment, but the returns are great. And we also need to think about this as a global community.
I think, that's it. It was a terrifying reality, and it was a testament to the international collaboration of the scientific community to develop and roll out such an effective vaccine in such a short turnaround. I think it's often not celebrated enough how much of an achievement that was by the global scientific community.
Yeah, I think people are so blasé now because COVID seems like, it's just a mild cold now. But the reason why it is like that now is because of what was done back in 2020.
Yeah. Thank you so much for your time, Sharon.
Great. Pleasure.
That brings us to the end of our series. Let's recap. We've heard that antiviral therapeutics were largely missing from our COVID-19 response, and that we can't afford to let that happen again. We've heard how the Victorian government is backing world-class medical research, including the development of therapeutics designed to keep people out of hospital when the next pandemic hits. We've heard from scientists leading breakthrough research right here in these labs, using cutting-edge platform technologies like mRNA to design the next generation of antiviral drugs. We've heard from global health experts about why therapeutics are essential to help low and middle income countries with already stretched health systems to weather the next crisis. And we've heard about the future we could have if we get this right, if we invest now so pandemic therapeutics are ready when we need them most. So we're all ready. It's been an honour to host these conversations. Now we look ahead together. I'm Dr. Matt Agnew, and this podcast series was proudly brought to you by the Cumming Global Centre for Pandemic Therapeutics, part of the Peter Doherty Institute for Infection and Immunity.